Good evening, everyone, and welcome again to Wellness Wednesday. Tonight, we have a guest that is going to help us with something that is tremendously important in the state of New Jersey and all over this country and possibly all over the world. It is our dental health. And so I have a great guest that we're going to be introducing in a second. But as always, I always start by introducing my guest, my partner from the Weekway Family Success Center, Trisha Jones. Trish, say hey to everybody.
Good evening, everyone. Again, Trisha Jones from the Weekway Family Success Center, located in the South Ward of Newark. You can find my office at 434 Chancellor Avenue, in the corner of Chancellor Avenue and Fabian. And it's great being here and partnering with Matt, the Family Success Center is up on this end of the Essex County. Thank you for joining us.
Great. As mentioned, what we do every single Wednesday is we host a Wellness Wednesday activity. And today, we're focusing on dental health. And so I was connected with a great group that is doing some phenomenal work throughout the state of New Jersey by the sister that I'm about to introduce. Her name is Nyeilla. She's going to introduce herself and the company. So Nyeilla, welcome.
Good evening, everyone. My name is Veale. I am the Perinatal Health and Wellness Program Director over at KinderSmile Foundation, but I have a great general understanding of all of the community programs that we have here at KinderSmile Foundation. We were initially founded in 2007, and overall our mission is to provide underserved children and families with access to comprehensive dental care and education, and stress the importance of oral health and really raise awareness to why oral health needs to be prioritized. We envision a future where every child has access to a dentist and dental disease is eradicated as it is preventable. So that's my quick little spiel.
That's a great spiel. Sticking right with the stats, I've read somewhere recently that the dental health of Americans overall is poor. And in our community in Essex County, New Jersey, it's struggling. People are struggling with their dental hygiene and their dental health. Could you tell us some of the stats that you're seeing through your company?
Yes, absolutely. So overall, just looking from a national standpoint, oral health is a topic that is completely forgotten, very overlooked, and not prioritized as it relates to overall health. And so here at KinderSmile Foundation, we're really striving to not only raise awareness to the importance of oral health, but effectively make sure that our resources are accessible for these families, and especially our inner city communities and those who don't necessarily have access to care if it really weren't for organizations like KinderSmile Foundation. So about 93% of the population that we serve falls into uninsured or underinsured, meaning Medicaid through the state, New Jersey Family Care, Horizon, any of those. But overall, again, oral health is a topic that needs to be discussed a lot more because its relationship to overall health. So if you think about it, like I like to tell families and kind of partners that I work with, is that anything that you put into your body has to go through your mouth first. So inevitably, your oral cavity, your mouth, your oral hygiene is going to be affected. So not only are we working on nutrition, not only are we, concerned about aesthetics, but it's really improving our overall health through the provision of oral health care and education. But not only in New Jersey is oral health not as prioritized, and a lot of our children and families are suffering from a lack of access to care, but this is across the board throughout almost every state. But New Jersey is, one of the kind of states that is not doing as well as the others when it comes to giving back to underserved communities. So we're really here to provide that education, provide the care, whatever your background is.
For me, I'm not sure how you feel, Trish, but I know when I was a kid, the dentist was always the scariest place on earth. When you go in and you hear that drill going, it's like, oh my goodness, what in the world is going on there? I never knew when saw anybody just eager to go to the dentist. It's always a heavy lift in that regard. How often should people in general and parents specifically take the children to see the dentist, I guess, for regular dental checkups?
Yes, so I'm going to put my perinatal health and wellness program hat on. we tell moms and parents that you should be bringing your child into the dentist either at 1 year old or when they get their first tooth. You don't want to delay that because let's say if they don't get their first tooth and you're not coming into the dentist, that could be a developmental issue. So at least 1 year of age or when that first tooth comes in, just to evaluate, the dentition and make sure that everything looks normal. So at our offices, Bloomfield, Newark, and Trenton, we are seeing infants all the way up to senior citizens.
Nice, nice. I had a zillion questions. Trish, do you have anything?
Yes, I did have a question. So, of course, you look very young to be in this field in that position. So, do you have a lot of parents that ask you about your years of experience and your knowledge before they actually allow, their child to be seen in your sites?
Not necessarily. I don't get a lot of questions. Just being in this position, I obviously have a lot of experience. I've worked with different families, so them just coming to me is enough for them to feel like comfortable. But there are times where I just do introduce myself to kind of break the ice. I actually started with KinderSmile Foundation as a CSLP volunteer, a part of their community service learning program. And so my future goal is to become a successful dentist, but I needed more exposure, especially in underserved communities and those who don't readily have access to care. Through hard work and a genuine desire to give back to these communities and kind of help reverse the statistics that have run rampant in these communities for decades, I worked my way through becoming a dental assistant, then becoming the administrative assistant of the foundation, and now the perinatal health and wellness program director. So through these different positions and opportunities that I've had with KinderSmile Foundation, not only have I been exposed to the need of organizations like this, but also just a genuine desire to want to give back, to want to educate and really kind of transform these communities, because dental disease is preventable, right? So what can we do? What tools can we give you to make sure that you have everything you need to lead a healthy lifestyle at home? Mm-hmm.
Thank you. Another question I had, because you start at age as early as one, you said, or the first two, right?
Yes.
So I have a granddaughter who's one. She must have
Mm-hmm.
about their 19th already.
Mm-hmm.
How do you work with that child that young of age to be able to, allow you guys to examine their teeth or anything else for that matter? I can't get her to say stuff for me, so I can only imagine how that could be a little challenging.
Yes. So from being in the room and being assistant and working with families, I would say it's all about coming in early, really desensitizing them to the dentist, doing lots of oral health education and getting them comfortable before they even sit down in the chair, right? So the more exposure that they have at home, start brushing at home, start getting them used to having like foreign objects within their mouth or people looking within their mouth, makes for a smoother transition here. And at KinderSmile Foundation, we're based on the principles of education, intervention, and prevention. So at all of our dental homes, we have a brushing station. At the brushing station, for younger kids all the way up until, our adults, we are teaching them the proper mechanistics of brushing. But for children, our staff are very experienced. They're working with children the entire time. I mean, it's not always going to be a smooth process, but it's really starting at home. So if you're able to come and be educated by us first and then come into our dental office, it's a very smooth transition and visit for not only mom and baby. But we do a lot of different things: talking, singing, making them comfortable, allowing them to hold objects, showing them what certain things are. And then we do a technique called knee to knee, where the baby leans back into the doctor's lap, but is still sitting on like mom, the legs are on mom. And she's just looking, she's counting, singing, but it's very conducive for a child, like the overall atmosphere. Mm-hmm. That answers your question.
Yes, it does. Thank you.
Wow, I'm really excited. I definitely want to have you consider we're going to be talking a little later about an activity that we're doing together on Saturday. We have a great mentor program for young girls called a gesture crown. And in addition to talking about the teeth, I think you are a perfect role model for the young girls that we have in the program to kind of look up to, what you could be, because you've got you're really doing really good stuff at this early stage in your career. And we could just say, I'm looking forward to the day where I can call you doc,
Me
uh,
too.
for sure. Um, So I guess just some other questions I would have, I guess, for the kids or even for the adults. Does the electric toothbrush really do that much better than the manual?
So I get that question a lot. Electric toothbrush is great. However, you still have to physically move your hand for it to be effective. So you can't just hold the toothbrush and let it vibrate on every single section of your tooth. You still need to have the manual dexterity and the proper mechanistics for it to be effective. But I would say introducing a kind of electric toothbrush, not until the kid has proven that they are able to brush properly, and also that their finger muscles and their wrist muscles are able to allow them to do so. They are effective, but it still requires a little bit of work.
Okay. You had mentioned that your organization, KinderSmile, why did they name themselves KinderSmile? What's Kinder all about?
You know, that I'm not too sure about, but I know our founder and CEO, Dr. Nicole McGrath Barnes, she has been practicing dentistry for so many years, and a good portion of her dental career was actually in private practice. But at some point, she started to bus over children from like different city communities, and she was realizing that a lot of children, especially Black and brown children that were coming into her office, were coming in with decay on almost every single tooth. And like I said earlier, all preventable simply if you have the access, the resources, and education, not only as a child, but for the parent too. And so from that experience, just seeing the need for more providers to give back to these communities, in 2007, she started bringing over children. In 2016, she officially opened our KinderSmile Community Oral Health Center Bloomfield, and that was solely for children. Now we've opened it up to uninsured adults as well as our perinatal moms. But really, I would say, I don't know the exact reason why she named it KinderSmile Foundation, but Kinder, just thinking like children, it's for everyone, right? But I would say the most impactful, especially in these developmental stages, is to educate and build kind of these techniques with children early on, right? Because
Mhm.
once they're educated, once they have all of the tools that they need, not only is it going to help that current generation, but future generations to come. And especially like working with a lot of Black and brown families, a lot of us are stuck in our own like cultural ways just because our grandma did it or, you know, our mom did it, but it doesn't necessarily mean it's right. And if it's not giving us good, healthy results, we need to figure out what to switch up. So here we're really providing the education, kind of getting rid of the old generational habits or kind of cultural things that we did earlier on and just focusing on moving forward. No judgment zone, but focusing on moving forward and giving all of the tools that we need to shape a healthier future.
Absolutely. Just making sure that you get the best health that you could possibly get, and use all of the resources and tools that are available now at your convenience. And so you said you were located in a number of different places. I know you said Bloomfield, Newark, and did you say Irvington as well?
Trenton. So that's
And
our main
Trenton.
community. Yeah. Mhm.
And so a person that is interested, that's going to hear this podcast and say, wow, I need to get myself or my children over to this center. Uh,
Mhm.
what do they have to bring with them? Because you indicated that you work with folks who don't have insurance. So what do they have to bring in order to get serviced?
Yes. So I would say definitely call before you make an appointment, or even if you walk into the office, we'll get you scheduled as a new patient there. But just to kind of give you a rundown of the patient profile that we're seeing, a lot of those are uninsured and underinsured. So at our Bloomfield location, I said we're seeing children. They can be uninsured, they can have insurance through the state, they can have private insurance through their parents. Regardless, our fees are significantly reduced. That way, if a family does have to pay out of pocket, it is still extremely affordable. At that location, we've also opened up services and education to uninsured adults. So the initial fee that they would pay is $75. That includes, you know, the exam with the doctor, the treatment plan, the actual cleaning, and all x-rays that they need covered by the doctor. And then we also see our pregnant and postpartum moms in that location as well. In our Newark location, it's unique. We're really in the community and for the community. We are located exactly inside of a Boys and Girls Club. So making
Nice.
dental care convenient and easily accessible for families. Not only are we seeing the Boys and Girls Club members, but we're also seeing the newer community. And then in our Trenton location, that's more of what I like to refer to as our family practice. Adults, adolescents, senior citizens, perinatal moms, children, whatever it is, everyone can go to that office, regardless if they have insurance or if they do not, due to any reason. What they would need to bring upon an initial visit is their insurance card, if they have insurance, an ID, just so that we can have that in the system. And then when they actually come into the office, they'll just fill out a registration form and get scheduled for their appointment. So it's a super easy process. Either call, walk in, or, email us.
Great.
Yes.
We deal with a growing population in East Orange and Newark as well, with residents who are undocumented, and they coming in, and some of them don't have any documentation, don't have any proof of income or even ID. If a child is in that situation where their parents just don't have any of those things, can they get service through your company?
Absolutely. So uninsured, whether it's due to documentation, citizenship issues, or, just not qualifying for Medicaid because you make too much, but you don't want to go through your job for a private insurance, we are still seeing everyone initially for that fee. But for those who are undocumented, there is a high percentage of families in our office who are undocumented. That doesn't mean they still can't get the care. We're still giving it to them. Instead of identification, if they don't have that, they can simply bring their passport, whatever it is. We just need some form of ID to prove that this is you. But
And do like, say if I was in that situation and I bought my nephew, he's not my son, or if I was a neighbor, does the child actually have to do I have to have identification for the child and myself, or do I have to have it? Does the adult have to have how's that work?
So the adult is the only one that needs to provide identification. All that we're requiring from the children is just their insurance card if they have that.
If
But
they have
ID is simply only for the adults.
Okay. All right. I have a zillion more questions, Trish, but I see you shaking your head. Did you have any?
I do have one, and hopefully this won't tell my age, but my question to you is this. There was a time in Newark years ago where a physician would go into a school, like a preschool, and just examine the kids' teeth. They do like a small, short examination. And then they would give a referrals for those who really need to come in for more preventive care. Do you all do that? And have you thought about it if you're not doing that currently?
So we are. So KinderSmile Foundation, like I said, in the community and for the community. So we have different community programs that are tailored to addressing the needs of this population that we're serving, right? So one of our programs is our KinderSmile Oral Health Program. That's where we're going into schools, community centers, locations and organizations that are serving the target population and providing preventative care, cleaning, exam with the doctor right on site. But ultimately, our goal is to link everyone back to a dental home. So let's say, God forbid, a kid had treatment that needed to be done, big or small. Although he got his cleaning and his exam with the doctor, if he does not have a dental office, we are linking him back. Obviously, we can't do larger procedures in classrooms, so we're actively linking them back to a dental home. That way they're getting all of the restorative work that they need done, and then also establishing kind of the 6-month recall plan and making sure that they're coming in biannually. But going into schools and community centers is working around barriers that prevent access to care. So parents don't have to take off of work, right? They simply fill out the registration form of consent for them. They're not sacrificing their pay. We are coming right in and just providing care that is easily accessible for these families, regardless of the situation that they have.
Awesome. Thank you.
You're welcome.
When a family comes to your center, if they speak a different language, do you have interpreters there to assist them in that regard?
So not necessarily interpreters, but overall across the board, KinderSmile Foundation reflects the community that we serve. So whether it's our board of trustees, whether it's people on the administrative side, whether it's actual doctors or dental assistants, we have everyone that fits the profile of the patients that we're serving. So we have assistants and front desk patient coordinators that speak multiple different languages. So communication wise, we are really able to kind of communicate and be very, very helpful to our families. Yes.
Wow, this sounds like a phenomenal place. I'm really looking forward to our families going there and getting the services. This Saturday, we have our Omega 5K run through the city, and we're also having our health fair there. And KinderSmile has been invited out to meet the public and participate in the various activities that we're doing. On Saturday, what can somebody expect? What type of information can they expect to get from your vendors table?
I would say definitely some goodies, an incentive to come to the dentist. So whether it's a toothbrush, toothpaste, little floss pickers, but mainly our promotional material. So really just informing them of the different programs that we have, of the different kind of payment plans that we have, of who we are serving, and just really providing them with all of the resources that they can take advantage of. So more information. We would love to provide like screenings on site. However, we're not able to this weekend, but more so information, and then also just physically signing up and then having our team call them and scheduling an appointment right on the spot.
Great, great. Well, as you know, we've been in this conversation, and I eagerly await the opportunity for us to have a Kinder Smile Day at the East Orange Family Success Center. Trish, is that something that you guys would be looking forward to do down here at the Weekway Center?
Yes, definitely, especially since we have a daycare right next door. If I can share the information with the director and we can partner, because we've partnered on numerous events, that would be great because she has like 24 kids in the daycare, and that would definitely be a great um event to do with them and helpful to the moms as well because of the work schedules.
Yeah, absolutely. And as you mentioned, moms too, you guys know that I'm the Perinatal Health and Wellness Program Director. So let me just share a little bit about that program, because that's still something that New Jersey is trying to improve, right? Maternal health in general, but through provision of oral health care, we're providing education and dental care to pregnant and postpartum moms. So we provide them with a basic oral health training on the importance of maternal oral health, what to expect during your pregnancy and after in regards to changes, inevitable changes that happen with hormones in your bodies, and how that can affect your oral health, and how that can affect your baby, and what's transferably, how to breastfeed, how to care for your baby's teeth to prevent early childhood caries, which happens in so many children, but again, it's preventable. And ultimately, these pregnant or postpartum moms, they do our educational course with us. And then after they complete education, they're eligible to receive dental care. And we talked about those being uninsured due to documentation issues. So through this program, if they are uninsured, they're not eligible for Medicaid, denied Medicaid, because they don't have papers or whatever it is, we provide them with free dental care. And that will cover the first dental visit, so the cleaning, the exam with the doctor, any necessary x-rays, and then it'll cover all recommended treatment as proposed by the doctor. And then if a mom has insurance, so easy, you use your insurance at the dental home. If they don't have insurance, they're opting out of it because it's too expensive through their employer, or they're not eligible for Medicaid because they make too much. Again, we offer significantly discounted fees for our moms. So all about just raising awareness to the importance of maternal health, because I'm not sure if you guys know, but poor maternal oral health can lead to low birth weight, preterm birth. There's a correlation between preeclampsia. So really just educating these moms and preventing these things from happening.
That's
Yes.
definitely something that we could share on our maternal health Saturdays with
All
our
right.
moms that come to the center. So yes, thank you so much.
Absolutely.
Great. You'll get to meet our Baby Best program. They will be there on Saturday on the second floor
Oh, nice.
doing their project. So I'll be making sure that all of the moms and the moms to be come downstairs and get a chance to talk with you as well. And then the one thing that I'm really pushing at the East Orange Family Success Center is fathers. A lot of the fathers, like I can tell for myself, my wife took care of all of the dental and hospital and all that kind of stuff. I mean, I took care of the bills, but I never was really there kind of with that first tooth. I can't even remember like how it got brushed, but I assume it did get brushed, right? Because I left it up to my wife. But right now we're trying to have we're working with young fathers, young men who in high school and college who are become fathers, so that they can understand the importance as them as the husbands and the fathers to be able to share this information with their children and themselves. What do you thought? What are your thoughts on young fathers getting this information? Do you think it's important for young men and fathers in particular to have this information?
Absolutely. I would say we don't necessarily have a program that is dedicated solely to fathers. However, through our perinatal health and wellness program, we've actually been in partnership with a couple of teen program high schools. So like the parent linking program, we've gone to Plainfield High School and we'll be going to Eastside and Patterson High School, but really not only gearing this information towards moms, because it's also still beneficial towards dads too. So we have dads sit in on our lessons and still receive the education, because they can too also take care of the child's teeth too, right? Whether it's wiping their gums, brushing their teeth, but simply just having this information as a young parent, not only for themselves, but also for their baby, has been proven to be extremely beneficial. Mhm.
Wow. All right, well, we're getting 30 minutes, man. It seems like it goes like right at this 30 seconds. It's 8:29 and our show is scheduled to end at 8:30. Um, we cannot be more proud of you, young lady, for all of the good stuff that you are doing. You are a shining example of what our community has to offer. And kudos for the work that you're doing. And like I said, our prayers will be with you as you grow in your career and finally become a dentist. We're going to bring our kids, our grand, for me and Trisha, it'll be our grandkids there to ensure that they get the dental services that are needed. Trish, I'll let you ask any final questions and then I'll close out.
You know what? I actually don't have any final questions. I think everything that you told us so far has been phenomenal. And thank you for enlightening us, definitely on the early ages of
Mhm.
dental care for our babies. We really appreciate that. And like Matt said, it's a great thing for young people, especially our young girls, to
Yes.
say, hey, here's someone who looks like me. I want to be able to do that same thing. So thank you for being an inspiration for our young people.
Thank you. And thank you so much for having me here and just being able to not only share what KinderSmile Foundation is doing, but just being somebody, that can represent our community and somebody that can help the younger generation and be a figure and a voice and an advocate for those who don't necessarily have the position or the voice to do so. So I appreciate you even allowing me coming on this platform and just really raising awareness to the importance of oral health, especially for our young Black and Brown children and families.
Great. So I'll close out by just asking you, I know it's a foundation, it's the KinderSmile Foundation. How do people donate to the foundation and how do people get in contact with you?
Yes. So donation, we are a nonprofit. You can visit our website at www.kindersmile.org/donate. You can donate to different funds that we have, but just know that it is improving the oral health of our community, especially for children and families in New Jersey who are underserved. And you can always send us an email, follow us on our social media platforms. We are on Facebook, Instagram, Twitter, YouTube, and we also just produced a documentary, really just highlighting the importance of oral health care and the lack of access to oral health care in New Jersey as a state. So really just trying to spread word and really kind of foster change, especially within the state and inner city communities of New Jersey. Yes.
Well, New Jersey and all of our East Orange and Weequay families that are out there, you've heard it tonight on Wellness Wednesday. It's extremely important that we take care of our dental hygiene and health, and it's extremely important that we start to sow the seed as early as possible with our children. I want to thank my partner, Trisha, and this young lady right that's doing phenomenal work with Kinder Care. We want to thank everybody for joining us tonight. You guys have a blessed night. God bless. Be well.